Welcome to the American Institute of Healthcare Professionals Videogram on PTSD Part 2. And in this part, we're going to be managing PTSD symptoms. And we're going to look at a variety of ways in which individuals can deal with and cope with particular symptoms of post-traumatic stress disorder, and as well as why certain individuals may not desire to seek the therapy that they so desperately need, and as well as to see what would the ultimate conclusion be for individuals who do decide to take that step forward, who do decide to go through therapy. What are some of the conclusions, some of the benefits of actually going through the therapy, and what they can later expect? So healing with PTSD begins when the individual finally accepts the event and applies certain skills to manage the symptoms. When the individual actually decides to confront the actual memory instead of trying to avoid it. Now, there's ways to manage symptoms, and then there's long-term therapy. In this video, we're looking more at managing symptoms on a consistent basis, and we'll leave a future video towards what various licensed counselors and therapists utilize to help individuals actually overcome the actual PTSD itself. But once an individual makes that very, very important step to confront the bad memory, the trauma itself, and to deal with that memory and not try to avoid it anymore, that's when the healing can begin. That's when the flashbacks can finally come to some sort of ending or conclusion. That's when individuals can start to find relief from the numerous nightmares, the arousals during the day, the things that are keeping them trapped in the past itself. So that first all-important step to will to be better, to accept the fact that something bad happened, and to want to manage those symptoms is the first most critical element in overcoming PTSD. And unfortunately, it's one of the most difficult for individuals that do not wish to face the problem itself. Now, the reason why it's a problem to begin with is the fact that the processing within the brain of the traumatic memory did not occur properly like normal memories. The regular processing and assimilation of memory itself, which is found within the amygdala. Within the amygdala, there's various memories that are first captured, and they're pretty much fragmented within the amygdala because that's the emotional side of the brain, the right side of the brain. And they're fragmented and individual, and they are then processed on the left side of the brain with the hippocampus. And with the hippocampus is a logical sorting of those memories within the hippocampus. And the hippocampus sorts them out, integrates these memories, and allows them to make sense within a narrative structure. Unfortunately, when severe trauma occurs, the amygdala is overactive and hippocampus is underactive due to the stress and the trauma itself. And a lot of these charged emotional memories get stuck in the right side of the mind, of the brain itself, within the amygdala. And this results in a process of being stuck in the past with trauma that haunts through flashbacks, arousals, nightmares, and so forth. Once the individual chooses to confront this, that's when the healing begins, and the reframing of trauma, the restructuring of the event, and understanding the event from a more logical perspective. And of course, throughout that process, there are various management techniques of some of the symptoms that an individual is going to experience throughout the recovery. And even after the recovery, there's still going to be some times when symptoms need to be managed itself. So when one recognizes the source, becomes one with it, claims it, but also releases it, this leads to an analyzation of the trauma and a deeper understanding of the event and how it fits within the person's life narrative itself. So there are a few symptom managements that can be utilized when it comes to flashbacks that are due to various arousals or triggers, or nightmares itself, fear of going to sleep, that you're going to have a vivid nightmare of the event itself. And a few of these are listed here. Affect management is about naming the feelings themselves and noticing those feelings without judgment, and just to listen to them and understand that all feelings that are associated with an event are normal to have and they're constructive to life. So in a safe place, obviously under the guidance, sometimes at least the first couple of times with a licensed professional, you want to name the feelings that you feel are associated with the actual event itself, and then to understand those feelings, why you're feeling them, and to understand if it's logical to feel them or not, and to understand that you shouldn't feel guilty for particular feelings in themselves. You're analyzing them. And after you work with a professional, after the individual who experiencing PTSD works with a professional, he can later, or she can later, utilize this in the privacy of their own home. Breath retaining is also very important. Hyperventilation can occur during a PTSD episode where one's having a flashback. So proper breathing techniques that are also associated with meditation and yoga to be able to calm the mind, to alleviate some of the physical symptoms themselves. Another important one is through Edmund Jacobson with progressive muscle relaxation, and also autogenic training to induce relaxation. This is a very important way to relax all the muscles in the body, starting from head to toe or toe to head, whatever way you want to start, and relaxing every aspect, every muscle within the body, and feeling that relaxation progressively go up your leg and up through your torso and so forth. Anger management skills are also critical. Many individuals who experience PTSD have issues with anger, and they emotionally let the anger out in unproductive ways. So anger management is very important for individuals to learn how to release that anger in a healthy way. And there are also a variety of intrusive management skills. And for sake of brevity, we just only listed a few here, but a few of them include grounding. Grounding is when an individual is experiencing a type of flashback and they need to feel themselves in the present. So grounding or anchoring themselves, so to speak. And that could be simply from stomping your feet or putting your hands on the side of a chair that you're in and feeling the fabric or the leather of the particular chair, of the arm handle, and just knowing by that touch that you are not, or the individual experiencing PTSD is not in the past, but you are in the present. So it's a way to utilize senses to tie oneself to the present itself. Place imagery is also a successful tool in symptom management for those experiencing PTSD. With place imagery, there's a preconceived area of a safe place. Could be a meditation spot, could be a very beautiful place that you once found immense happiness in. For some, it could be the beach, others, it could be the mountains or a log cabin. Wherever it might be, it's a place that is correlated with a sense of happiness, peace, safety, tranquility. And you imagine this place, the individual with PTSD imagines this place. And when a trigger arouses a flashback, or one awakens from a nightmare, you go to this spot that's preconceived and you allow it to calm you and so forth. Split screen is another important type of mental way individuals can manage symptoms. Split screen is imagining the past event on one side, such as on a television or a monitor, and the other in the present, where the individual is at the moment. And by looking at both, you can rewind, you can pause the one side of the screen that is in the past, and you can watch the present itself. And you can do whatever you want with either, but you're acknowledging, again, a type of grounding that there is a present, there is a past, and you are in, or the person with PTSD is in complete and total control of the past event itself. It's also an important one listed here, a symptom management called feeling dial. And this is something, again, that is done prior, where an individual looks at a feeling that is associated with the particular event, and you rate it on a scale of 1 to 10, and then you gradually lower it. How would it be to get to from a 10 to an 8 to a 6? And what would it feel like? And you pre-associate feelings with these particular numbers. So when the event does come, with breathing, you're able to relax, breathe in, breathe out, and think of those numbers, and to gradually calm yourself down through that feeling dial itself. Another common one is referred to as dirty laundry. You're tossing away imagery of dirty laundry into a washer or into a bin of some type. And those are the memories or the trauma that you're experiencing at that particular moment. Now, all of these are just symptom management techniques. So when someone is dealing with PTSD and someone has a flashback or awakens from a very vivid nightmare of some type, they can use some of these techniques to better control the symptoms and to bring oneself into better control and to better emotional calmness. So these are just some ways. There's many, many more, and it's best for individuals who experience PTSD to discuss what symptom management techniques are best for them in regards to their particular issue itself. In addition to individual counseling, personal counseling can also be supplemented with support groups. And support groups are to be used only when the individual is at a certain stage in their recovery from PTSD, where they are able to control anger, where they're able to control anything that results from a flashback that could put them into a state of danger to themselves or others that are within the group with them. But once an individual is able, who's experiencing PTSD, is able to enter into a support group, there are a variety of benefits that they can secure from that. Number one, a sense of security and safety and an acceptance within the group and no stigma, because everyone is experiencing an event that was horrible, and they're sharing in that event, and they're talking and discussing about how it feels. And sometimes many have feelings that aren't really correlated with the event. They feel shame, and there really shouldn't be shame. And this really helps because it helps against alienation of an individual, because everyone is sharing secrets. They're being revealed, and individuals are able to find out by hearing what others are saying, to point out, well, you know, why would you feel that way? And then they can reconvene and look inside their own self and say, well, I said that about the individual across from me. Now, why am I holding myself to the same standard? So open discussion, revelation of secrets, and sometimes saying something out loud with those who've experienced the same thing can really put the light on, can shine a light on things that are detrimental to yourself and aren't really giving yourself justice in regards to what that person is experiencing. Also, there's other coping methods, how others have dealt with a certain incident, a certain trauma, and how they later dealt with those. And those can be shared as well as various friendships in themselves. Still, unfortunately, many individuals refuse to attend group settings or deal with various counselors that have an expertise in PTSD. And that's because there's a variety of inner blocks that are preventing them from getting the help that they need. Some of it is, as we talked about in the first, is confronting the trauma. Well, they have a fear of confronting the trauma. The healing starts when you confront it, but the trauma is so terrible that they're having a very, very difficult time doing it. Also, some, especially soldiers, they have fear of treatment itself being a sign of weakness, to the fact that they're courageous on the field and they have to hold to a certain standard. And anything that is considered to be of the mental side is a sign of weakness instead of an actual wound. Physical wounds are treated, but mental wounds are invisible. And mental wounds aren't given the same treatment and the same care that physical wounds are in many soldiers' eyes. A mental wound isn't really a wound at all. It's just a sign of weakness for many soldiers. Fear of discovery of the issue itself. Some individuals believe that ignorance is bliss. Others fear rejection from the therapist. Maybe they've never opened up to what occurred, to what happened, and they're afraid of some sort of rejection, that they are evil. And usually they find out quite the opposite, that you've been harboring these thoughts against yourself and you're not evil. Fear of becoming overwhelmed with these emotions that you're finally being forced to face, very similar to confronting the trauma. Fear of losing even the good memories. And there are memories maybe an individual shared, say a soldier shared with his comrades on the battlefield. They shared a friendship. They were together, they worked together, and they're afraid of losing maybe some of those, or some of the good things that they did on the battlefield, liberating a city. Also, there's a fear of, for some, of giving up harmful coping behaviors, maybe drugs or something that are utilized to help cope. And the individual doesn't want to give up drinking, doesn't want to give up these particular drugs themselves. And also fear of losing secondary gains due to the condition. Many individuals might be used to being babied, might be used to having this support from others. And without that support, they don't feel that they can stand on their own to hold the fort together, so to speak. So they might be afraid if they get help, then they're going to be all on their own again. And they've been not on their own for such a long period of time that this is kind of a scary experience for them. But if you go through and you learn to manage the PTSD and later go through recovery, which I said again we would discuss in future videos, there are benefits. There's going to be a reduce of flashbacks, dreams, and distress and associations. Less triggers that are going to come out and grab an individual. This doesn't mean that it's going to be permanently gone, but there's going to be a lessening and also a lack of intensity when they do occur. You'll be able to recall an individual PTSD. You'll be able to recall the past without false detachment, false narrative about the actual event, and also reduce the arousal that's associated with feelings of the past. An individual will be able to think back to that event as a normal memory without the intense charged emotions that are trapped in the amygdala. There'll be less anxiety and depression and isolation. And finally, the loss will become integrated, and one will be able to integrate that past with the present and the future. So it's critically important, going back to the first slide, to confront the trauma so that these benefits can come, so that the memory can be properly integrated. And it's important to learn how to control these symptoms while you're dealing with your recovery or an individual with PTSD. We are the American Institute of Healthcare Professionals, and here below is our stress management certification and crisis intervention certification programs. There's links for each of them. Our number is 330-652-7776, and our email is info@aihcp.org. So feel free to contact us with through any of those means. And if you're interested in stress management or crisis intervention or even grief counseling, these programs, if you're qualified, would benefit you, especially in regards to helping individuals with PTSD. Again, PTSD is a lack of integration of traumatic memory. And the only way an individual can overcome it is through confrontation of the past trauma. And that's the hardest thing to do. I'd like to thank you for listening and have a good day.